What is hypertension? Hypertension is sustained elevation of systemic arterial blood pressure. Systolic blood pressure would be 140 millimeter mercury or over. Diastolic blood pressure would be 90 millimeter mercury or over. The norm for blood pressure is 120 over 80. Two types of hypertension, primary hypertension and secondary hypertension. Primary is the essential hypertension caused by something indirect, occurs in 90 to 95% of clients. Secondary hypertension is caused by something direct, example kidney disease. It occurs in 5% to 10% in adults and over 80% in children. Our focus is on primary hypertension. It's a silent disease because it is frequently asymptomatic until it becomes severe and target organ disease occurs. A person with severe hypertension may experience secondary symptoms such as fatigue, reduced activity tolerance, dizziness, palpitations, angina, and dyspnea. Primary hypertension is caused by something indirect, such as smoking, obesity, hyperlipidemia, and diabetes. Primary risk factors are advanced age, alcohol/smoking, diabetes mellitus, high dietary sodium intake, gender, obesity, family history, and stress. Complications include hypertensive heart disease such as coronary artery disease, left ventricular hypertrophy, heart failure, as well as cerebral vascular disease, peripheral vascular disease, nephrocirrhosis, and retinal damage. The diagnosis of hypertension is not based on a single elevated reading, but several elevated readings over several weeks. The first test is routine urinalysis, which is used to screen for renal improvement and to provide baseline information about the kidney's function. The second one is serum creatinine levels, which is the same exact thing. So anything higher than the normal range can indicate that the kidneys are not functioning properly. The third one is blood glucose levels. It assists in the diagnosis of diabetes mellitus, which could be a complication. Electrocardiogram is done to provide information about the cardiac status in case there's any problems with the heart. The measurement of serum electrolytes, especially potassium, is done to detect hyperaldosteronism, a cause of secondary hypertension. Ambulatory blood pressure monitoring is a non-invasive and fully automated system that measures blood pressure at a preset intervals over a 24-hour period. Once the results are in and there is a problem, meaning some of the results are out of range, specifically high, the nurse will need to do further testing and will come up with a plan of care. How does a patient with this health condition receive care? A patient with hypertension receives care in a hospital setting depending on how severe the condition is. Otherwise, the patient visits the hospital to follow up with the test results and further testing if needed. The visits also require the nurse to check the patient's blood pressure and examine the effectiveness of the treatment. The nurse also teaches the patient how to check blood pressure at home frequently. The health professionals involved in the care are physicians, specifically cardiologists, pharmacists, dietitian, physiotherapist, psychologist, and nurse. The physician diagnoses the condition as well as any other complications, comes up with the tests that need to be done as well as treatment, with the assistance of the nurse, which will be performing the tests on the client.